Trying to fall pregnant can be an emotional roller coaster of hope and disappointment, and fears about not being able to conceive can be overwhelming. We understand the pressure you may be feeling as time moves on and as people around you are falling pregnant and having babies. We support you through the ups, downs, and uncertainties involved in trying to conceive. Pregnancy can bring about much anxiety. It can be a time when fears or obsessive thoughts can be debilitating. Some women experience antenatal depression. This is hard when those around you and you yourself expect to be joyous. You don't need to keep feeling this way. We see you. The loss of a baby can bring about utter devastation and despair. Some women and couples seek emotional support for pregnancy loss, both for miscarriage and stillbirth. We get that you may be feeling alone and that no one really understands your pain. We understand, and we're here to support you through this. We're also here to help you make difficult decisions about your pregnancy, when medical diagnoses have been made, or if you're unexpectedly pregnant and unsure about what to do. We're non-judgmental and unbiased in supporting you through this difficult decision-making process. Anticipating childbirth with apprehension or fear, or needing to debrief after a traumatic birth also brings women and couples to our network. The postnatal period brings abrupt life changes and relentless demands. Postnatal depression affects 1 in 7 new mums. Feelings of worthlessness, guilt, loss of pleasure in things you normally enjoy, negativity, irritability, loss of motivation, difficulty making decisions. These are some of the symptoms of postnatal depression. We use evidence-based treatments to help you with postnatal depression and anxiety. Postnatal anxiety is more common than depression. At this vulnerable time, you may find yourself worrying about your baby's safety and about all the things that could go wrong. Some women experience intrusive, distressing, and even disturbing thoughts. We're very used to hearing the anxious thoughts that plague the minds of new mums, so you don't need to feel ashamed or afraid to reach out for help. Stress and overwhelm is a common problem among parents, and we help you to understand your triggers and better manage your stress. There isn't a parent in the world who doesn't experience stress at some time or another. We see you when you're feeling doubtful about your choices or feeling inadequate as a mum. The way in which you were parented may be causing distress. You may feel confused, lost, or guilty about how you're going as a parent. We hear you. We can help you to bond with your infant and to be clear on what your values are as a parent. Everyone is different. We see you as the individual you are and help you to get closer to where you want to be. We also see dads who experience postnatal depression, anxiety, or stress, as the postnatal period can pose significant change and responsibilities for new dads. We help you deal with the juggle of work and motherhood, and to manage the pressures that the early parenting years bring. Our psychologists are here to support you through the challenges of conception, pregnancy, birth, the postnatal period, and the early parenting years. Many people tell us that just making the first call to get help is a big step towards feeling better. Our psychologists will talk with you directly so that you feel as comfortable as possible when you reach out for help. We can link you in with key perinatal support services to ensure that you feel fully supported. Links to these services can be found on our website. You may want to follow our community Facebook page, which has become a trusted resource for expectant and new parents, with helpful articles to support you through motherhood and parenting. Our website is a rich resource of information that we hope will assist you to find the help you need.